we're going to see the photo, and Dr. Perlmutter can tell you what all these things are.
All right. I just have 4 photos, I think. I'm not
Okay.
sure what order they're going to show up in.
Well, we'll get to it. Go ahead, Lee. Okay, what's this?
Okay, so this is a fellow, you're actually looking at him the 2 days after his surgery. Excuse my cough. That's his big toe.
Oh, he didn't have a thumb.
He did not have a thumb. And he refused to let the cartel know where his grandkids were. And so they have a penchant for cutting off part of your right hand. The first time, the second time they have a penchant for killing you.
Oh, good grief.
And so he's a baker, and so he needed to support his family.
So are
I'm so
those
sorry.
pins sticking out? They're like stabilizers?
Those are pins. In the United States, we would still use pins similar to that, a little bit different form, but those are pins holding his toe onto the base of his thumb.
Okay.
So we remove the toe, reattach the nerves and the arteries into the hand, and it lived. He has a functioning thumb.
Wow, that's amazing. Okay, Lee, we'll go to the next one.
So we talked about birth defects. This is a little girl that was born with 2 thumbs. And so that's highly dysfunctional. There's one bone one metacarpal bone, which is the bone immediately at the end of your forearm. And from that, in a Y-shaped pattern, is the metacarpal bone. And then there's 2 normal distal bones at the end of those. So the job here is to eliminate one of the thumbs and centralize the other thumb on the end so that it grows normally and doesn't flop off to the side or anything like that. So it's more art than medicine. That you really have to work with carving. It's highly a carving job and ligament reconstruction and nerve repair. These are a boatload of work. It's a 4-hour surgery.
Oh, yeah.
Done well, and it's a 4-hour surgery in that environment. It's an hour and a half, at Nash Hospital.
Gotcha.
So, the outcomes are amazing. The fact that you can take the dominant right hand of a little girl and give her a normal looking hand with some very hidden scar tissue is terrific.
Right. Those instruments must be so fine. I mean,
they are.
Nerves are like, there's itty bitty, teeny weeny.
They are.
As are the arteries.
Yep.
And that size thumb.
Yep. That by way of comparison, that's my thumb in the photograph.
Right. So she's really little.
Yeah, but that's the time you have to get to them. The earlier you can get to them. I've operated on a much younger than her.
Oh, wow.
And the younger that you can get to them, the better it is. So that's a win. Just to continue the discussion in a different vein, this little girl. In many countries, I don't think it's so much true for Honduras, but in many countries, particularly the rural parts of Ecuador, they would never get married with a hand like this.
Oh, really?
No, they would never get married. A boy would never get married with a clubfoot.
Are they considered like it's a demon or it's an evil spirit or?
Probably more of the latter. They're almost predominantly Roman Catholic countries, but that there's a word for it, but when I asked for it to be translated, they told me our translator said voodoo, but it's not really. It doesn't translate exactly into that. There's ancient religious thoughts still pervade,
right.
and But kids with birth defects tend not to get married, and their social life gets destroyed.
How
so,
awful.
So you really don't just give them a hand back.
Yeah,
you give them
a
a
whole
life
life.
back. Right.
Yeah, yeah.
So this is a little boy that did not form any digits. There's no surgery on his index through pinky digits. The fingers just didn't form. And so the first thing before we move toes is we have to create the base of the thumb. And so I separated his index metacarpal out and rotated it so that it becomes the base of a thumb.
Oh, wow.
And so now he may choose to just keep that and use that as a pincher, or may choose later to put toes at the end of those two bones so that he has longer digits to pinch against. So.
Wow. All right, Lee, the next one. That's amazing.
There she is.
There she is.
So we're in Honduras here. It's the first time I've seen her in almost 12 years.
Oh, wow.
12 years, maybe 18 years. And she's a doctor there, and I'm so proud of her.
You should be proud of her. That is just such an awesome story.
Yeah.
And she's still, didn't you say you're going to try to get her into Miami for her hand fellowship?
We are, yeah.
Yep, that's awesome. Okay, Lee. Next. Oh, there she is
So
again.
this is a picture she sent to me after she tracked me down, and I didn't know who it was at first, because she's playing a guitar.
Yeah.
And then she said, "It's me, stupid." So, but last time I saw her, she was 5 years old.
Oh, yeah, a little girl.
Yeah.
Wow. Okay, Lee. Isn't that awesome?
But
And you made those fingers for her.
I did.
Yeah? All right.
That's another picture she sent me. She's playing doctor in Ecuador.
She'll be a fabulous physician.
Yeah, she is.
Okay.
So this is an interesting picture. So she's, I put this up to show the hand on the right. That's the simplest of things that we work on there. And if you can see, the middle finger and the ring finger are fused together. So of all the deformities that we fix there, or even in the United States, that's the simplest. It's just separating two fingers out. It's when all five are fused together that it becomes more complicated, because then the bones fuse together too. But if you look at the hand on the left, that is a hand of Alba that I operated on 18 years earlier. So yeah, this is the two hands, my first patient I've operated on overseas, and my last one that I operated on overseas.
That is so cool. So for this one with the two fused, is it their bones are there, everything's there, you just kind of...
In that kid, the bones were there. We saved her as the last patient because we were literally catching the shuttle bus to the airport as I put her dressings on. You know, so we saved simple ones for last. So there was, in this case, the bones are not attached at all. It's purely skin.
Okay.
And so it's a much easier separation.
Yeah.
If you look at Alba's hand on the left hand of the screen, her index and middle finger were just skin, and so they separated beautifully. But if you look at her pinky and her ring, there was bone that was attached between those. So the scarring is worse.
Right,
the outcome is not as nice because they were sharing bones. And sharing a joint in that case too. So
but she can play a guitar.
she can play a guitar.